My name is Dr. Gresham. It's true, I am in Paris, France. A little bit about me is I did some work in the correctional field for about six or 7 years. And now I'm in Paris talking about the correctional field. I'm not working in the correctional field. So one of the things I wanted to talk about in particular about correctional psychology is just, there's lots of different areas specifically related to correctional psychology that have a very specific and significant impact on the way we provide mental health services there. And one of the, there's lots of different, how do we say, subcategories that you face whenever you're facing a patient. So your classic patient in private practice who has a substance abuse issue. You take that same person, put them in prison, and now they have lots of different troubles and struggles that really interfere with the way they're able to receive mental health treatment. So one of the things I want to talk about specifically is in a male's prison, what kinds of things really impact their ability to receive treatment and to progress in a way that allows them to kind of recover from some of their struggles, recover some of their trauma, and heal. So there's a couple different things I want to talk about. The first thing I want to start with, as I mentioned, was substance abuse. Believe it or not, there are so many drugs in the prison system. So many drugs. And so when we are working to take our men who have come into prison for a drug-related offense or an offense not related to drugs, but sometimes they're using drugs to cope with depression, to cope with anxiety, to cope with past trauma while they're in the prison system, these things can sometimes be overlooked. Another thing that we see a lot from a correctional psychology perspective is these various diagnoses that patients can have just like in a hospital. Well, when you take someone who's high on drugs, sometimes those diagnoses look the exact same, but when they're high on drugs, we don't know. And so one of the things that happens a lot in prison settings, and we do a lot of drug testing, We do a lot of spot drug testing. We do a lot of routine drug testing because we want to make sure that the symptoms that we are seeing in our patients are organic and they're not induced by substances, because that really impacts the way our psychiatry prescribe medication to our patients. So it's really, really important to be aware of that. Substances manifest in lots of different ways, not just through usage. It manifests through selling, because we're taking a lot of times when men go to prison, a lot of times they're the breadwinner in their family system. So they're still expected to provide for their home, even from within the prison system. And that is a very cultural way of being, but it's true. So you see these young guys and even sometimes some of the older guys who will come to prison, who will find themselves into a drug ring so that way they can smuggle drugs, so that way they can sell drugs, that way they can get money and send it back home. Now, the details of how they're sending the money back home, I don't know. But it's something that happens and it's a regular occurrence. So when we're thinking about men who are men outside of prison in their homes, and then we take them and put them in a correctional setting, there's almost like this idea that the roles that they play at home are going to change because they're no longer at home. But in fact, a lot of times those roles don't change. They're still expected to be a father. They're still expected to be a husband. They're still expected to be a breadwinner. And these are things they try to recreate within the prison walls. So it's really important from a correctional psychology perspective to be aware of that, to be aware that these sort of like pressures of still being the man at home, it still exists in the prison system. That's not something that changes just because they're no longer at home. In some cases, not all cases. Another thing I wanted to talk about is gangs and how gangs manifest themselves in a prison system, but also into the community, and how that shows itself in a male's personality and the way he's interacting with friends, the way he's interacting with family, interacting with peers. So in lots of prison settings, not just in California, even in the New York prison setting as well, which is where I worked as well, you'll notice each gang has a specific set of rules. There are guidelines to live by. And with these guidelines, they will dictate whether or not men can go to mental health treatment. It will dictate whether or not they can eat with a certain race. It will dictate whether or not they can live with a certain race. It will dictate whether or not they can live with someone from a specific criminal offense. And with these crimes come a certain level of awareness about, we'll say, I've had an inmate has told me before, the gang kind of dictates the kind of person you want to be. So sometimes there are gangs that won't allow them to live next to sex offenders. And so then there are other gangs that will allow you to live next to sex offenders. And so it creates a picture of who you think this person is based on the kind of gang they're affiliated with. And who they're allowed to affiliate with really touches deeply, because outside of prison, some of these men have close relationships with people from a different race, people from a different neighborhood, people from a different culture. But in prison, they're no longer allowed to have some of those friendships and relationships. And so it really interferes with their social support. And that's something that you see over and over. The social support is something that kind of evolves because people are being transferred all over the country, depending on if they're in a federal prison, and all over the state if they're in a state prison. And these relationships are constantly being ruptured and constantly having to restart and kind of redevelop themselves, revamp themselves over and over again. And so you see a lot of loneliness in this prison system. So these are the things I'm trying to talk about, the things that are obvious in the prison system, but the things we're not thinking about. We're not thinking about the loneliness from losing friendships in the prison system. We always assume that the loneliness comes from missing family. But when you're 500 miles away from home or 600 miles away from home and you're sentenced to 15 years in prison or maybe longer, it's unrealistic to think that they're not going to develop some sort of friendships within these prison walls. And when we're constantly having them torn apart from having to transfer to different prisons and not being able to communicate or affiliate because of gang politics, it really creates a sort of like loneliness that you see kind of manifest itself in the negative behavior, the substance abuse, and other things. Another thing I think that we should probably talk about is understanding manipulation. What is manipulation? Everybody manipulates somebody. My dog's manipulating me right now to get off the Zoom and go get him a bone, right? He's sitting here crying and, he's like dancing, and he has this duck and he wants to, this is what he does. He wants me to get up and get him a bone. As soon as I go get him the bone, he's gonna ignore me. That was the plan. The plan was for me to get up and do what he wanted me to do. Everybody manipulates. But there's this idea that prisoners are like the bigger, badder manipulator, right? It depends on who you ask. Some people will say yes, some people will say no. The point being, though, everyone does it. It's not just this unique skill that prisoners have and the rest of us don't have. When my mom used to say things like, can you vacuum the floor? I really like it when you do it. I don't do anything special when I vacuum the floor. She just wants me to do it because she doesn't want to do it. But it makes me feel good that she likes the way I do it. So what do? I do it. I'm the sucker that got roped into vacuuming the floor. It's the same kind of thing. It's the same sort of experience when you're working with the inmates. The difference is the types of things that you will likely get manipulated for are things that can get you in a lot of trouble. And so I think it's important to, from a correctional psychology perspective, understand that manipulation it's a part of the job. It's a part of the gig. Understanding that the goal is to manipulate you, to get you to do what you want them to do. If you were incarcerated for 25 years, you didn't see your family, you didn't see your spouse, you had very limited friends, and you weren't in school, you weren't working, what would you do all day? I know what I would do all day. I'd try to get guards to bring me chicken. I try to get, well, not anymore if I'm vegan, but before I was vegan, try to get the guards to bring me snacks, try to get the guards to bring you a phone. If you're addicted to drugs, you're going to try to get the guards to do that as well, right? It's normal. This is normal behavior for someone that's antisocial. So you really want to pay attention to these sort of things and try to use your clinical training to help yourself get a better understanding of what's going on, but also to better understand your client, understand their needs, and help them develop some pro-social behaviors and pro-social skills from this antisocial behavior, helping them see that they don't have to manipulate you if they need something. They can just ask. But part of coming from this kind of antisocial background with the friends, with the gang culture, part of that experience is learning these bad habits and then manifesting these bad habits over and over and over again in every environment that you're in. So manipulation is something that happens on an antisocial level. It's also something that happens, I think, on a clinical level a lot. We hear a lot of people talk about when patients are suicidal and they're just saying they're suicidal, but they're not really suicidal. Well, how do we know if they're really suicidal or not? Just because we think so? Well, the one time we think they're not suicidal, maybe they really are. So there's a lot of thought, I think, that needs to go into this idea of what manipulation really is, what it means, how it manifests itself in a correctional setting, and what we can do to kind of combat it in a way that's clinically appropriate, but also helps our patients get their needs met without having to do antisocial things. It's quite a task. Does anyone have any questions about manipulation? I just want to ask before I move on.
No, but my dog just manipulated me as you were saying that. I just thought that was hysterical.
They do it. Everyone does it. Everyone does it. The other thing I wanted to talk about, and I wanted to spend a little bit of time talking about this, and they kind of go hand in hand, is what we would call the Prison Rape Elimination Act, and how that impacts the STD rate both in the prison and in the community. So many, many years ago, we'll say maybe 20 years ago, I did a research project, and I looked at prisons across the United States, and I wanted to see how many times they were testing inmates for HIV on their way into prison. I'm just curious, can someone just type in the chat box, how many times do you think, 20 years ago, how many times do you think inmates were tested for HIV during the duration of their time in prison? Just run some numbers in the chat box, let's see. 0, okay, what else? 0, what else? 3, 1 time. Test you on the way in, good luck on the way out. So what happens is 20 years ago, you had hundreds of thousands of men going into the prison system, getting tested for HIV, maybe other things, definitely HIV, and then living their prison life, and then going home to their families, going home to their spouses, going home to their kids. And one of the things that not only is a huge issue in the prison system, it's not just HIV, but it's hepatitis C, because there's so much drug use. And now, now technology is so far advanced, and now in a lot of ways, inmate care is sometimes better than probably all of our medical care at this point, but it's very, very good. It's very good. And so now you can get tested for hep C, you can get tested for HIV, you can get treatment, you can have all of these things. So it's no longer an issue now. The point I'm trying to make, though, is 20, 25 years ago, were they being tested for these things? No. Were they being treated for these things? No. Were we concerned about how the male population, females as well, but specifically we're talking about the male population, how the male population were being not only treated in prison, but also how they were able to go back to their families and be successful. This is just one of the few ways that they're being kind of set up for failure and not being set up for success. So this is something that is an ongoing issue. So the reason I brought up the Prison Rape Elimination Act is because it is an act that was put into place to help inmates feel safe with regards to their sexuality in prison. So anything can be considered a violation of this PREA, and not just a physical act of sex. It could be sexual harassment, it could be touching, it could be any of these sorts of behaviors that make someone feel unsafe because of their sex. So, and it's not just specific to inmate to inmate contact. This also is specific to inmate to guard contact, inmate to staff contact as well. So one of the reasons why I brought this up is because I think the name sort of gives this implication that Prison Rape Elimination Act specifically speaks to prison rape. But do many of you know that there's no such thing as consensual sex in prison ever? Never ever. Can't have sex in prison. Even if you want to, you can't. I see some people shaking, you can't, you definitely can't, you can't do it. So what happens is maybe you'll find two males who have decided they want to be in a relationship together. Well, now, if they're caught having sex, depending on the circumstances, there could be the likelihood that they could get more charges. So now they have more charges. Now they can't get out of prison. It could be that they're sort of like ostracized for being in these same-sex relationships. Sometimes it's very, very common for the men to have same-sex relationships and then go home. And again, not being thoroughly educated on sexually transmitted diseases, how that manifests itself in the prison system, how it manifests itself in the community, and how to take care of yourself whenever these things sort of come to pass. So there's a lot that goes into that. And I think it's really, really important for us to kind of understand how that impacts the psyche of a man who's been taken out of his home and placed into this environment. And I mean, you know, the logistics about why he's gone to prison, that's not really what my talk is about. My talk is more so just about how men are experiencing the prison system and how psychology can help heal some of these kind of like negative experiences that they're having. Reintegration is also a really, really big issue. So all of these things I'm talking about, substance abuse, Prison Rape Elimination Act, STDs, manipulation, all of these sorts of things go into kind of my final kind of like subject I want to talk about, which is reintegration. When you look at the prison system globally, not even just in the United States, but also here in France, and we look about what we're doing to reintegrate inmates from the prison system into the community. What are we doing? Can anyone think of a couple of things that we're doing other than putting them on parole, doing some drug testing, giving them a psychologist that they might see once, giving them some medication they're probably going to dump because they didn't like the way it made them feel in prison in the first place? What are we doing to help them integrate? What are we really doing? Not a whole lot. And so it's important, you know, it's important that we are really taking a look at, okay, we're bringing them to prison. We're giving them stellar health care now. 20 years have passed. We figured out how to help make Hep C levels so low that it's non-detectable. We're figuring out how to make, keep them off the Hep C, keeping them off of the needle drugs, keeping them from sharing needles, keeping them sober. We're giving them treatment. We're healing their trauma. We're getting them stable on medication. We're doing all these things. But then we're sending them right back to the same environment that they were in. We're sending them right back to the same place that forced them to have to carry a gun in the first place, that forced them to have to be in a gang in the first place. We're not really doing anything to help. So I think along with educating our patients on substance abuse and getting them to have a better understanding of what sobriety means to them, having them understand that their health, that their body is a temple, and we need to take care of our body through the non-use of needles, through exercising, through diet, through taking our medication, through doing all of these various things that are going to help us stay healthy, through coming to terms with our sexuality so that we can not only just not have to live in hiding, but just being able to live a full life. Talking to them about having pro-social behaviors, pro-social activities, doing things that lay people do, not having to lie, not having to steal, not having to do things to get their needs met. All of these sorts of things will really contribute to whether or not our inmates are going to stay out of prison. So does anyone have any questions? I see someone talking about, yeah, the body is a temple. Yeah, it is.
All right, Dr. Gresham, we have about 10 minutes left, but less than 10 minutes now, about 8 minutes. So if anyone has any questions, you can ask now, unless you want to be put into a breakout room. So you can send a chat. If not, you can ask it now. Thank you.
I was going to say to Dr. Gresham, I worked at a rape crisis center in Riverside, California, but I got to work with PRIA. I got to go into some correctional facilities and stuff. And I think it's getting those individuals who work there on board, because I remember one of them saying, you know, we don't need PRIA here. Rape doesn't happen. And I was like, what? And I didn't say anything because obviously I was respectful, and I'm like, I'm in their facility. I'm in their home basically, you know, and I'm trying to be able to come there, and I'm trying to be able to do groups and see these individuals that are there. So it's like I had to kind of shut my mouth a little bit And because I really wanted to say something, but I think it's finding a way to talk to them about it in a way. I don't know how to start that conversation, or if it's more training or something, because it's, yeah, that was what I saw a lot there. And the LGBTQ plus community, that was a big thing. They were just, there's a lot of comments made that I also, again, I had to like kind of shut my mouth about. But I don't know if it's, like I said, training or what has to happen, but it was in a lot of the facilities there. And that was just in Riverside County. I don't know about like, but
I can say that that experience that you had is, you know, sadly a common experience. It's a common experience, and I think what's going to have to happen is just generally a mentality shift in the way we view rape and what it means to be raped and what it means for a man to talk about rape, what that means, what that looks like. And there needs to be more training, there needs to be more understanding about it. And you know, it needs to be a mentality shift. That's the best way to describe it. It needs to be a mentality shift, because you're right. There were multiple times when I remember multiple times where I would have someone who would say, like, you know, this guy, you know, someone from an LGBTQ community would say that it may touched him, and then he would tell the guard, and the guard would be like, walk it off, it's no big deal. It's like there is a whole law put in place so that you don't have to deal with this. So you have to do something. So I just remember multiple times having an officer call and say, what are we going to do? It's like, what do you mean what we're going to do? Have you read the act? What does the act say? You're going to do all the steps the act says, you know, and kind of having to re-educate them every single time. Like every single time you call me and ask me what to do, I'm going to say the same thing. And really kind of I think one of the things that really helped is making sure that the person that you are working with that is reporting the assault understands that you know that they have rights and you're not afraid to assert those rights on their behalf. That is one of the biggest things. Someone had asked a question about how do inmates go back to families and be successful? It's difficult. It's difficult. And it's different for everyone depending on how long they've been incarcerated. Some people have been incarcerated, you know, for a year and a half and they're getting out. Some people have been incarcerated for 25, 30 years. Some people have been incarcerated 30 years total in a span of 2 years, 3 years, 5 years, 10 years. It's different for everyone. And sadly, I think more needs to be done to really help educate and inform people who are being released from prison on how the world has changed. Like, have you ever had, let's say, a niece or a little cousin who the last time you saw them, they were 3 years old, and then you moved away, and then you went back home to the family reunion and they were 13, and you were like, oh my God, who is this person? It's a whole new person. Well, imagine that being your life for everything, with cell phones, with televisions, with cars, with food, with new trends, with music, with everything. The people that you know, you go to prison, your family members are, you know, 15 years younger. They've had 15 years worth of experiences. They've had 15 years worth of time to evolve and to change and become different people. And so they have to learn how to adjust and to adapt to their surroundings, and not enough attention is paid to things as simple as that. So it's true. So I think
I did have a question. So I worked with sex offenders in outpatient treatment after being released, and I noticed a lot of the trends is not only getting accustomed to like the changes the world has went through, but kind of accepting the fact that they are kind of stuck in time and not understanding certain things. And I've noticed that when they do come out, not only is it a learning curve, I'm trying to figure out like what is the world going through, what's new, what's going on, but it's also accepting some of the experiences that they had within the prison system, or some of the things that they changed about themselves to be able to kind of maintain sanity in the prison system. Because I had clients that were lifers who thought they were never coming out, and then all of a sudden they were released. And now they're like, I have to rework my brain. I don't know what it is to be outside anymore or interact with people in a loving way, because I turned that off to survive. And now I don't really know how to re-access it.
Yep.
So I noticed that was like a large trend, as well as not being able to process things that might have happened within the prison system that would be considered rape or sexual trauma, not being able to process it as that. And they're like, oh no, that's just prison stuff. It just happened. This is what happens in prison.
It's true. You'll see it in the way they make food. You'll see it in whether or not they're willing to come be in big crowds. Every time I'm working with someone.
Valene, I'm just going to interrupt you. You'll have 2 minutes, but I just want people to know if you want to be in the Q&A to let us know, because we're going to be shutting this down soon. So just to let you know, you have 2 minutes, actually 1 minute before the next presenter comes in.
Okay.
Well, thank you. And thank you for coming. I will be in touch with you later on.